Welcome to the Physical Activity for Older Adults eHealth tool presented by Matt Tucker and McLean Myers. This eHealth tool will provide you with useful information and strategies on how to exercise in a safe and mindful way. As you work through your way through the eHealth tool, I would like you to keep in mind the idea of mindfulness. You may be asking, what is mindfulness? Well, mindfulness is a way of being that promotes a return to the present moment and cultivates awareness. It allows the individual to analyze what is going on within their physical, emotional, social, mental, and spiritual self. It is through mindfulness that allows you to select the physical activity that you enjoy, as well as providing you with several health benefits that will strengthen your ability to slow down, concentrate, and prevent excess soreness and unsafe exercising. The topics covered in this eHealth tool include the physical changes that occur during ages, what is physical activity and exercise, barriers to exercise, benefits of physical activity and exercise, what exercises are okay and how much do you need, being mindful and having compassion, as well as goal setting and safety. Before we dive in further to our eHealth tool, it is important to define physical activity and exercise. Physical activity can be defined as any movement that results in energy expenditure. This can occur in your occupation, such as at work. This can occur through sport, playing with your kids, or even household activities, such as doing the laundry, tidying up, folding, whatever it may be. On the other hand, exercise is physical activity that is planned and structured with a general goal or objective. So exercise would be going for a walk, attending a fitness class, doing aquafit, any activity that is time limited with a goal or objective. The important thing to remember here is that both of these have health benefits and are good for your health, such as preventing chronic disease, which we'll dive into further on the following slides. Before listing the benefits of physical activity and exercise, it's important to understand the changes associated with normal human aging. As we age, we see a decrease in physical activity. We see increased risk for chronic disease such as diabetes and hypertension, as well as cancer. There's a decrease in muscle mass and strength, flexibility, balance, as well as stiffness occurs. However, as you will see later, that exercise and physical activity can help delay this as well as prevent it. Some of the key benefits of physical activity include improved balance and flexibility, reduced number of falls, prolong the ability to stay independent, improve and maintain body weight, maintain mental health, and improve self-esteem, as well as helping prevent and manage symptoms of heart disease, stroke, osteoporosis, type 2 diabetes, and some cancers and premature death. What often gets overlooked is the benefits of exercise and physical activity on the brain. Exercise has been shown to lessen the effects of dementia. Exercise improves many higher mental functions, such as your short-term memory, your ability to problem solve, stay focused, memorize new things, and recall information from the past, all of which are very important as we age.
Now that we've heard the importance of making physical activity and exercise a part of a regular routine as we age, it's important to consider aspects of how it can be incorporated, such as the frequency and time, along with the type of activity you should be engaging in. So how much exercise do you need? Well, of course, this is slightly dependent on your unique situation, but a general amount to strive for is about 2.5 hours of moderate to vigorous activity per week. An easy way to view this would be roughly 30 minutes 5 times a week, or on most days. However, the way we go about achieving this can totally be tailored to your life. For example, instead of 30 minutes straight in the day, it can be just as beneficial to complete more frequent 10-minute sessions. So this number of 2.5 hours a week has been determined as a way to gain the majority of health benefits that have been previously discussed. However, if more practice in your activity already, this does not mean you can't do even more to achieve even greater health benefits. Some quick tips before you get going. Firstly, start slowly. Try only making one change at a time. If generally quite sedentary, a simple walking routine can be a perfect start. Listen to your body. Some discomfort and muscle soreness is expected when trying new activities or increasing intensities, However, substantial increases in pain may be a sign that activities could be adjusted. Consider increases to duration and frequency before worrying too much about intensity. For instance, adding just 5 minutes more to a walk or swim, or adding in another day of the week before being too concerned about how hard the activity needs to be. And then making a plan by picking a time and a place. Taking classes at your local community, joining a local walking group, or incorporating a routine where you walk before and after lunch. So what types of exercise or activities should you be doing? Well, if just starting to incorporate more physical activity in your life, don't be overwhelmed by the huge amount of options out there and trying to do too much at once. But ideally, with time, your activities will look to include a variety of fitness aspects, like aerobic, or activities that increase your heart rate, resistance training, like lifting weights, balance training, and flexibility. The good news is a lot of activities incorporate a variety of fitness aspects into one, so be creative and look at all the options out there. In regards to aerobic exercise or cardio, which provides some of the greatest improvements to overall health, try to consider activities that will raise your heart and breathing rate moderately or vigorously. Moderate activities could include things like light walking, cycling, and swimming. With this, you'll notice an increase in heart rate and breathing, but still be able to hold a conversation. For example, you'd be able to say your address without needing an extra breath. With vigorous activity, like jogging, skiing, or faster cycling, this would take you to the point where your talking becomes noticeably challenging and more frequent breaths are needed. So using that address example again, you likely wouldn't be able to say your entire address without needing a couple extra breaths. Strength training can be a fantastic way to keep your muscles and bones strong and capable. Even small increases in muscle strength can make big differences in your ability to stay independent and carry out everyday activities. Common examples include traditional weightlifting, climbing stairs, and even yoga. But don't be put off initially if you feel intimidated by resistance training. The varieties are huge, with options for both individual and class-based programs. So what could a week look like when you're getting going? There's so many options, but the following could represent a realistic way of structuring a week that allows for rest days when starting out. When you get going starting any new activity or program, it is important to remember to listen to your own body. Some degree of muscle soreness is normal after exercise, but you know your own body best, so pay attention to your own signals. If feeling sore or that the activity is too much, it's totally fine to take a break or adjust the level of activity. In addition to the many health benefits discussed earlier, exercise can also provide a great way to be mindful and present to the current situation without worrying too much about external thoughts and focusing strictly on the movements you are completing.
It is important for you as you start your physical activity journey to be mindfully engaged in the experience. There are several important considerations that you should keep in mind before you begin exercising, during your exercise activities, as well as after you are finished. Firstly, it is important for you to be curious. Do not be afraid to ask questions and understand that there will be some degree of uncertainty when you start. However, building upon your curiosity is the idea of being committed. After you have found something that you enjoy, make a commitment to yourself and, if you would like, others, that you will engage in physical activity. Pay close attention to the choices you make and whether it aligns with your values, goals, and desires. Next, it is essential when starting something new to aim for competence. Obtain as much information as possible so that you feel confident in your ability to exercise safely. There are lots of resources available, such as the ones provided later in this video, that can help you increase your understanding of physical activity. Lastly, as you engage in physical activity, make note of your correspondences. It is important to understand that the way you interact within your environment and with others can shape your overall experience. Be mindful and reflect on whether the activities that you are doing and the ones that you have chosen is right for you and that it aligns with your values and beliefs. Also, make sure that the environment itself is right for you. As just discussed, it is important to find something that you're compassionate about. Start by writing down activities that you think you'll enjoy or find pleasure from. This can be done through self-reflection or writing something down on a list. Exercising in a group has been shown to bring others close together and be a positive experience. So consider group activities such as fitness classes. Have self-compassion. Do not be too hard on yourself. if you are having difficulty starting out. Be mindful that exercising can take time to get used to and takes practice and time. Having self-compassion helps you make better choices and analyze your emotions and physical well-being, all of which are very important when exercising.
Many people find that having a firm goal in mind motivates them to move ahead on an activity. You've likely heard this many times, but by putting pen to paper and setting goals, it's an excellent way to get you going on the right track and keeping you accountable. When doing so, try to remember goals that are SMART. SMART goals stand for goals that are specific, measurable, action-oriented, realistic, and time-framed. So instead of just saying that you'll walk more, try writing, I will walk briskly for 15 minutes 3 times this week, or I will complete 2 20-minute sessions each week that strengthen my muscles and bones. We've left a resource at the end of this presentation for you to have a worksheet that can create a few goals for yourself. Finally, make it safe. Many people feel hesitant to begin more structured exercise programs out of worry towards the risk of injury or harm. The reality is, for almost everyone, the benefits associated with activity far outweigh any risks. In fact, most older adults don't have health problems that would prevent them from doing some level of moderate activity, and there's almost always a way for every older adult to exercise safely and get meaningful health benefits. The key to this relies on tailoring your specific activities to your unique health circumstances. Risk can be dramatically decreased by discussing your individual context and activity goals with a qualified health professional. So, for example, talking to a doctor or nurse can help you further identify things like any activities that may need to be avoided. For instance, maybe you have dealt with a recent cardiovascular issue that would make it safer to engage in only light to moderate exercises and limiting any vigorous work for the time being. Also, how to modify activities to your unique health needs. Maybe you feel you shouldn't bother with strengthening due to chronic knee pain. While this may mean that certain modifications to what exercise can be done, there's almost always a way that some level can be completed. And finally, how medications can affect activity. If using a variety of medications, a discussion with a doctor or a nurse can be very helpful. For example, adjusting the time and engaging in activity based on blood glucose levels and diabetic medication timing. Thank you for listening. This concludes our presentation on physical activity for aging adults. We hope that has been helpful in providing some solid starting information to get you on the right path to including more activity into your lifestyle. Listed here are a few sites that can provide you with further information and support, along with the resources and worksheets promoted throughout the presentation.